I think President Obama is probably moving in the right direction with this health legislation. I think really older people have been really very much gifted by Social Security and by Medicare. When I started my ministry, there was an older couple in my congregation who both became ill, and it exhausted all their resources just taking care of them. And I think nowadays most older people have Medicare or some means of taking care of their medical needs, which is a very great need. I think we need to extend that to younger people, that same kind of medical care to younger people.
The Episcopal Church has some unique structures that are very particular to who we are, that can allow us to be a voice on aging, to take the lead on aging. We have this really incredible General Convention structure, which gives us as people the ability to make choices and proclaim who we are going to be. The task force is looking at resolutions that General Convention resolutions that deal with economic structures, that deal with social structures, that deal with calls for liturgy to acknowledge who we are and to acknowledge particular things about aging. The wonderful thing about General Convention is at General Convention, the Episcopal Church can proclaim to our government affairs office, those who interact on Capitol Hill, who interact with legislatures, who interact with the White House, to say, here's what these people of faith want our path to be as a country. The Episcopal Church has always taken a significant role in the governance of the United States. And we have a duty to continue to be a strong voice in the governance of the United States. Part of that call needs to be to continue to converse about health care. But there are also significant other things that we need to talk about as well. We need to talk about housing and the elderly. How are we meeting the needs of elderly and older Americans who live in very differing lives? That we have older adults who can pay for housing, we have older adults who really can't pay for housing and get subsidized housing, but we have older adults who don't fit in either and are living with challenges in regards to that. We also have a significant call to deal with elder abuse. It is not something that we talk about. We have the ability and the call to address the issues of elder abuse. Elder abuse can take a number of forms. It can be sexual, it can be economic, it can be health related, it can be self-neglect. There is not a church organization, there is not a church denomination that is currently helping to lead the United States in saying this is an issue and this is something that cannot continue any longer. And the Episcopal Church has a call, as we who are members of the body of Christ, to hold up a part of the body of Christ that is being neglected and abused.
I think that we need to really advocate for a single payer in the healthcare system. People are being charged money and rates from private insurance that I think are too high. Older people need all the money that they can get to survive, and I think if we had single payer health care, that would help financially, and it would also help access. Access is a real problem still in poor communities, whether they be poor white people or poor black people, Asians, whoever. Access to health care is a real problem that we should work on for older people in general. Another problem related to aging, and particularly in poor and minority communities, is housing, of course. Particularly in a city like New York, where things are becoming more and more gentrified, and even if a person is 80 years old and owns a home that they've struggled to pay for and remain in, if the property values around their home keep going up, then their taxes are going up as well. So we need to work on housing for older people.
If I had the chance to sit down with President Obama, I will say first, I have heard behind the scenes that you are not as interested in seniors and aging as you should be. Two, I'd say your grandmother was very important in your life, and are you valuing other people's grandmothers? Three, if we don't start to look out for the aging population now, what's going to happen in the future? Because we're going to get blocked. It's going to be in the pipeline, economic issues. If we're not taking care of people, what will America look like in the future? We talk about aging in place, which is what people want, but what are some of the things that are going to help aging in place to stay more functioning? How do we know those people are aging in place in a healthy, positive way? So I'd love to really almost have the chance to have a national task force on aging, and maybe that's something the Episcopal Church can become a leader in a role in something like that. Let's advance this issue. It's not going away. No one gets out of here alive. Aging and death are realities. So my feeling is recognize that fact, and let's say, how can we make it good for each other and good for America?
In terms of the legislative governmental issues that face the aging and the church, there are many, many issues, and the one that really concerns me is the people who are going to be retiring in the coming years, that there's a lot of discussion of Social Security, and that's been a real safety net for many folks, and and for some people who are baby boomers who've lost funds now, who don't have jobs, and some of those people are using their retirement money to live on now. And it concerns me that somehow we need to preserve the Social Security, because it is a basic level, and look toward ways to help begin to get either more personal savings on people's radar or some mechanism. But legislatively, I think preserving the Social Security is one issue that is important.